¿Qué fue lo que le pasó?
Pues nos echaron la mano para operar mis ojos. Ya mi vista se encuentra bien, estoy bien.
Sí, estoy contento porque me van a operar. En la escuela se burlan de mí.
Out of 72 million Mexicans that make up the population of Mexico, 65% of them live in poverty. Because there are professionals and doctors who donate their time, resources, experience, and knowledge to care for the poor. And in doing so, they change lives, families, and the communities of Mexico. Because it is through giving that a person becomes noble and life takes on meaning. It is because of all of this that Unión ProVida exists. At Unión ProVida, our mission is finding the highest quality and specialized medical attention and care for those in need. Our vision is to summon our efforts and talent and have our will be the driving force that allows the expansion of our services. Love and respect for human dignity is what motivates us. Generous teamwork is our strength, and above all, instilling integrity amongst our staff is priority. At the very beginning, our first patient was a woman who underwent a procedure to remove fibroids in 2004. This was done with the help of the CEO of the Beneficencia Española de Tampico Hospital and Dr. González Guerra. Seeing the generous response from the executive committee of the hospital and the surgeon, we daringly asked for more support in hopes to reach more patients. Doing this opened our eyes to the willingness of many that wanted to help our cause and encourage our goals to be accomplished. Inspiration and determination took us through the first few years. Assistance and support came sporadically, but the idea of creating a foundation was not in our sights. However, the amount of sick people that came to us kept increasing, and with that, the need to search for more doctors and collaborators was imperative. With the increasing demand of people in need of medical attention, and the number of doctors and volunteers fortunately on the rise, the hospital CEO and the committee chairman reiterated their support. Thus, the creation of a foundation was established in 2012, and Unión ProVida was born. Today, Unión ProVida is a complete network of team players with more than 90 doctors that we collaborate with in almost every field of medicine. And with the support of Bene Hospital, we are able to reach out to the people most in need and bring them together under our care. We also have partnerships with several local and outside foundations in the medical fields and shelters for accommodating our patients when they need to be cared for abroad. It is with this pooling of resources and talents that we have been able to offer the widest range of specialized medical and surgical care to our patients. It is through our volunteers' enthusiasm and generosity that the Unión ProVida Foundation achieves the synergy to potentiate the value of each peso invested, 13 to 15 times its original value, into medical care of the highest quality. That is saying that with 10,000 pesos, we can successfully do what normally is achieved with 150,000. These are people with limited resources, without any kind of coverage for their illnesses. They come to us having lost all hope of medical care and in many cases, in risk of dying. We have seen that besides recovering their health, a greater part of our patients and their families changed their outlook on life and the perspective of indifference from society to a deep appreciation for God and life. It is with great happiness that we have witnessed desolate cases of hopelessness turn into miracles of life, flourishing with new beginning. With this same joy, we have discovered and have been deeply touched by the extraordinary generosity of the doctors and benefactors that have been involved in making this miracle true. We have found that besides great talent, there is a huge desire to serve and the means to do it. When we team up and each of us shares a little of what we are and what we have, we can make life fairer to those who have less. Doctors, institutions, and benefactors, each of their contributions and interventions have been invaluable and have made immense change in the lives of patients and their families. Thank you for your generosity